What is chronic fatigue syndrome? Chronic fatigue syndrome, also called myalgic encephalomyelitis, is a complex, debilitating, long-term medical condition. It occurs when people suffer from prolonged fatigue for reasons that cannot be identified. The disease is characterized by several symptoms, the most prominent of which are feeling weak and in pain. Women are 2 to 4 times more diagnosed with symptoms of chronic fatigue syndrome than men, affecting most people who are in their 40s or 50s. What are the causes? The cause of chronic fatigue syndrome is unknown. People may be predisposed to the disorder from birth, which is then triggered by a variety of factors. These triggers include eating disorders. Inadequate supply of vitamins and minerals in the body causes chronic fatigue, since the body lacks the proper nutrition it needs to perform properly. Viral infections. Physical or emotional trauma. Symptoms may begin shortly after a surgery, injury, or significant emotional stress. Weak immunity. The immune systems of people who have chronic fatigue syndrome appear to be impaired slightly. Hormonal imbalances. People who have this syndrome also sometimes experience abnormal blood levels of hormones regulating muscle responses. What are the symptoms? The primary symptom of chronic fatigue is persistent tiredness, which could last up to 6 months. About 25% of chronic fatigue sufferers experience this symptom. The chronic fatigue which patients experience here is very different from the one after a stressful day at work. It is severe and weakening, and cannot be relieved with even the shortest sleep. In fact, most physical or mental activities would worsen the condition. Cognitive dysfunction, which includes symptoms like memory loss and difficulty concentrating. Post-exertional malaise refers to extreme exhaustion, after even a simple mental or physical exercise. Sleep deprivation is another prominent symptom. While they may be able to sleep for the normal hours, when they wake up, they won't feel revitalized at all. A person's sleep becomes nothing more than a routine with no physical benefits. Muscle and joint pain are also likely to occur. In addition to all of this, the patient will experience multiple episodes of headaches as well. Cervical lymph node tenderness may be seen. A sore throat may occur occasionally as well. What is the treatment? To suffer with chronic fatigue is certainly not the type of condition that a human being wishes to have to deal with. After all, a constant feeling of tiredness and exhaustion is hardly an optimum way to spend one's life. Since the exact cause of chronic fatigue syndrome is yet to be determined, there is no known cure for it at present. Treatments are meant to relieve the symptoms and improve the patient's bodily functions. Doctors recommend a combination of medications and non-drug therapies. Dietary restrictions and nutritional supplements are also used to help suppress the symptoms. In addition to therapy, lifestyle changes are also highly recommended. Thank you for watching, and please subscribe or follow for more videos.